Okay, I think, you guys okay to get started? Do you want to give it another minute?
Let's do it.
Okay, great. Well, welcome everybody. For those of you just joining, hi, I'm Olivia. I work at the NPKUA, and we are very excited for today's webinar with our PKU team at BioMarin. I will give them a brief introduction and then we will hop into their presentation. We really hope this is an interactive and helpful webinar for all of you. And just to let you all know, there will be a chance to answer any questions that you guys have at the end of the meeting. So there's a Q&A tab that you can click and just send in your questions to our panelists. With that being said, I'm happy to introduce our PKU team at BioMarin, which includes Kate Delaney, who is the Senior Director of Global Patient Affairs, Deborah Lounsbury, who's the Senior Director of Clinical Science, and Bethany Fireman, who's the Regional Lead of Global Patient Affairs. So thank you all for being here, and thank you to our panelists for doing this. And with that, I will pass it over to you guys.
Thank you very much, Olivia. So welcome everyone. Can we have the next slide, please, Olivia?
One second here.
Of course.
There we go.
Yeah, thank you. And we're very grateful to have this opportunity. We want to, first of all, thank you very much for joining us, because it is a great privilege and a pleasure for us to be with you here this morning and this afternoon. Along with the three of us who are part of the PKU team, there truly is a village of colleagues who stand with us and beside us, who work on the PKU program at BioMarin. So I wanted to share that we are a very small fraction of those colleagues. And as Olivia shared with you, I'm Deborah Lounsbury. I am in clinical science in the late stage development program, if you will, at BioMarin, but I am the medical monitor of the study, the PEGASUS Study 165306, and it's a great privilege and a pleasure. Thank you very much for having us. Kate?
Thanks, Deborah. Thank you, Olivia, for the introduction. Thanks to all of you in the community for joining this webinar today. We were really excited to be here with you and have this opportunity. I'm Kate, and I work in Global Patient Affairs. I'm a Senior Director, and I am a Global Lead for the PKU and the LSD programs from the patient advocacy or patient affairs side of BioMarin. And I'll hand it over to my colleague, Bethany.
Thank you, Kate, and really happy to be here today. My name is Bethany Fireman. I'm on the Global Patient Affairs team with Kate, working on PKU. I also work on our HCM program and our Duchenne muscular dystrophy program. Excuse me. My background is in patient advocacy, so really love to be involved in events like this. So really excited to be here. And just as a brief reminder before I pass it back to Deborah, we're accepting questions and welcome questions, and we'll be answering them at the end. So feel free to put them in the chat and we'll answer them towards the end. So I'll pass it to Deborah.
Thank you very much, Bethany, and we really, again, appreciate this. So we have a limited number of slides to share with you. We really do want to have some engaging feedback. So again, please save your questions and enter them into the chat, and we'll go ahead and answer them as we move forward. So the next slide, please. And I think Kate is going to introduce the company of BioMarin in just a couple of slides, just to share with you what we have been working on and what we're committed to study. Yep, thank you.
Yep, thank you. So as you can see with my background, I'm based in snowy Minnesota. BioMarin is based in California, in Northern California, and it's a company that was formed in 1997, more than 25 years ago. And our focus has really been on small patient populations. So people living with, managing, and experiencing a day-to-day life with rare conditions. We are rooted and collaborate through our core values here on the slide. Most important to me and relevant to this webinar today is our connections with you all, the patients and the communities we serve. We have a commitment to science. We have a commitment to being courageous and maintaining our curiosity. And we also have a commitment to being inclusive. Next slide. I mentioned our commitment to patients, and this is at the heart of what we do and has been at the heart of what BioMarin has done over the past 25 years. A large part of our commitment and our work over the last 25 years has been with the PKU community. So our dedication to the PKU community has been strong and continues. And really just using this opportunity today reinforces that, our commitment to you all and our gratitude to you in the work we've been able to accomplish at BioMarin. And I think with that brief introduction about the company and our background in working in PKU, I'll hand it back to Deborah.
Thank you, Kate. Olivia, we'll go to the next slide, please. So we are studying Pegvaliace, which is a Phe metabolizing enzyme treatment that has been approved for therapy in adults with PKU, and we're studying this in adolescents with PKU. The risk benefit has been well characterized, and thus we're conducting this study in the adolescents, and we'll talk about those age groups on the next slide. But it is truly our privilege to conduct this clinical trial in adolescents with PKU. We have learned, and we continue to learn through the community and adolescents with PKU and their parents and their guardians and their siblings and the families of the significant unmet medical need and the struggles that have been ongoing. So we are truly dedicated into committing to this clinical study to study, if you will, the risk and the benefit of Pegvaliase in this patient community or in this adolescent community. And we're very, very pleased and privileged to have that opportunity. And we continue to learn. We continue to learn about the struggles. So thank you very much for sharing with us, and thank you very much for allowing that opportunity. This is a very rigorous study design that, based on the data for our primary endpoint, we will determine if it is possible to expand the label of what's currently approved in adults with PKU into the adolescents with PKU. So with that, we understand the importance, which I'm sure you understand the importance of this drug in this community. Next slide, please. I'm going to go over the very, very high level. So please, you may have some questions, specific questions, and enter those into the chat, and we'll talk about that at the end of the couple slides that we have here. As with any clinical study, there is always a screening period, and there's a 4-week screening period. And during that time, that's when truly the eligibility of that patient population, or those participants, if you will, are determined and confirmed. And so the physicians, the investigators participating in that study will actually determine during those 28 days if they're eligible to be enrolled. And once they're determined to be eligible to enrolled into the study, 2/3 of those adolescents are going to be enrolled into the Pegvaliase treatment arm. This is open label. So open label, and those adolescents are going to receive, there's 36 of them in total that are going to receive the Pegvaliase treatment. Now, 1/3 of those, because this is a study that is for a regulatory approval, if you will, for a potential label expansion, we need a control group. And that control group, 1/3 of those patients, 18 of those adolescents, are going to be receiving for 72 weeks the actual diet, stay on the diet that they have enrolled in the study, that it is a fee-restricted diet that they may continue to have struggles with, but whatever diet they have been over the last 12 months, 6 months, whatever that diet is, they're supposed to maintain it. But to be clear, all adolescents enrolled in the study will be maintaining their dietary protein throughout the life of the study. And that's important because at the end of the day, we need to make sure that the difference in the changes in the blood Phe that we're going to analyze is actually due to a drug and not to the variation, if you will, in the dietary protein that the adolescents are consuming. So after a 1.5 years, about 72 weeks, those adolescents, 18 of them, are going to start to have Pegvaliase. So they will get the treatment after the 72 weeks, and they will continue on with Pegvaliase as we look at data and determine if this is something that we can actually determine to be the risk-benefit ratio is that we will file to get an approval for this adolescent population. That is the high-level overview, if you will, of the study. Next slide, please. So this is only key eligibility. We're going to share with you in a couple of other slides just where you can actually find specific eligibility and numbers that you can call and people you can speak to about specific eligibility. But this is just some high-level eligibility. So in the US, we are conducting the study in the US, and we're conducting the study in Germany. So in the US, we're studying individuals, adolescents, 12 through 17, so less than 18 years old. And then in Europe, because it is approved for 16-year-old and above, older, if you will, we're studying the 12 to 15-year-olds. So those inclusive, of course. Now, PKU is the disease, if you will, that we're studying. And most particular, it's the adolescents who truly on the current treatment that they're prescribed by their clinicians, they're unable to maintain, if you will, blood Phe levels that are 600 micromoles or about 10 milligrams per deciliter. They're unable to control those. So they're continuing to have challenges, and their blood Phes continue to be elevated, if you will. That's the second key eligibility criterion. So because diet and maintaining diet is very important throughout the study, the adolescents will be working very closely, as you do in your day-to-day life, if you will, with dietitians and nutritionists. So during that, the study, the adolescents will be working very, very closely on not just maintaining and adjusting dietary protein, but also they will be working very closely with dietitians. And then because it is an adolescent study, there is the requirement that for each adolescent who is enrolled in the study and receiving Pegvaliase, that they will have an adult or a parent guardian be with them during their injection, and then also for a minimum of 1 hour throughout the study period. So those are the key inclusion criteria for eligibility. Now, some of the exclusion criteria, any individual who has previously been treated with Pegvaliase is not eligible for the study. And then, of course, any medication, because we are exploring and looking at the investigational product that's treating PKU and the high Phe, any medication that is intended to treat PKU must be discontinued before they actually start the study. So that could be 14 days before they start enrollment. And then it's really, really important for adolescents to be able to communicate, and when they're with any type of clinical study that they're participating in, when they don't feel well, or not just for a severe allergic reaction, but just when they're just not feeling well. So it's really, really important that adolescents be able to communicate that, and that the parent and the caregiver is also willing to carry with them an injectable, if you will, epinephrine pen at all times. This is a drug that actually has some potential allergic reactions associated with it. So that is a requirement for participation in this study. These are the key eligibility. There are specific eligibility that are listed on the ClinTrials.gov website that we'll share with you in just a couple slides. Next slide, please, Olivia. Thank you. So in the US, I shared with you, we are conducting the study in 16 centers. And these clinicians in the US are, majority of them are currently activated and actively screening and enrolling adolescents in the study. So all of the sites are listed also on the ClinTrials.gov website, along with contact information. If you live or you're interested in this study, to please go to the ClinTrials.gov website and you can contact the person that's listed for a center that may be near where you live. Next slide. And then, as I shared with you, the trial is also being conducted in Germany, and there are 4 sites that we have the great privilege to be participating with in Germany. So again, in Germany, these are the sites. There are contact numbers and names that are listed there to ask any questions about the study and participation. Next slide, please. And then lastly, as Kate shared with you, BioMarin, we are incredibly committed and dedicated to supporting patients, adolescents, adults with rare diseases and their families. So this study, of course, we have that adolescent family participant support available. There are virtual visits that can be conducted along with some home healthcare nursing. So those can be in collaboration with the clinic visits. And then in addition, there's travel reimbursement that is provided for the adolescent and or the parent or guardian, so that there is travel reimbursement so that there's not out-of-pocket costs that are actually occurring. There are also, of course, IRB approved stipends that are provided for clinic visits and visits that are conducted at home in the home health by a home healthcare nurse. And then we have a variety of materials that are available to help not just with the education before an adolescent is enrolled, but also just about information about the study and support, if you will, documents that help them, adolescents and the parents, as they move forward throughout the study. So there's a significant number of support mechanisms, if you will, that we have in place. And they're certainly not limitless by any means, but they are significant in what we can do to help support you when you're in this study. Next slide. So this is the contact information that I previously discussed. The clinicaltrials.gov posting has a significant amount of detail about the study, and I encourage you to visit the website. I encourage you to contact your clinician or clinician that may be listed near where you live. In addition, the study is listed on the BioMarin.com, if you will. That's another opportunity. And if there are any questions about the study that you have, you may also call the BioMarin medical information line, which is answered by a person during the working hours, the 800-93-4587. And then also they have an email if you'd like to email the medinfo@biomarin.com. And the next slide, please. On behalf of my colleagues, Kate, Bethany, and a village of colleagues, we want to thank you significantly for listening to us and for allowing us this opportunity. It's been a great privilege and a pleasure, and we welcome any questions that you may have regarding this study. Thank you very much. We appreciate it.
Thanks, Deborah. And as Deborah said, put any questions into the Q&A box. We're happy to answer any. We do have a few minutes left here, so happy to sit on the line. In the meantime, we did have a couple of questions that came in prior to the webinar. So I'll read those now and we'll answer those to the best of our ability. One of them was, my daughter is 12 and has hyperphagia form of PKU. Does she qualify?
Thank you, Bethany. I appreciate that. And that's an excellent question. And there, as I shared with you on the eligibility slide, and we don't need to go to it, Olivia, but on the there's a significant number of criterion that for determining eligibility into the study. So we recommend speaking with your clinician, speaking with one of the sites that may be close to you, or asking some questions of, you know, your geneticist or whomever, your local physician, as well as those that may be listed. So they may be able to answer additional questions for you. Absolutely.
Great. Thanks, Deborah. It looks like we got a couple of questions in the chat to answer. So John asks, when is the start date for these trials? for patient selections.
Thank you, John. Appreciate that. And absolutely. This study is actually ongoing right now. So the study is currently recruiting. It is open to screening and enrollment. So they are currently ongoing, John. Thank you. That's an excellent question. Appreciate that. Thank you.
And Kristen asks, approximately how many in-person visits will be involved? How long does the study run?
Thank you so much, Kristen, for that. And Olivia, would you please go into the slide that actually does the study design? Thank you. So and Kristen, it's actually the specific question of number of visits would be answered by an investigative center that's listed on the clinicaltrials.gov. But this is a study that over the long term is 3 years, approximately 3 years. But the first year and a half, we will do the analysis after that 72 weeks to determine that primary endpoint between those two groups. And then we will, if you will, based on that data, continue the study and then look for a submission, if you will, based on that data. So this is not a short-term study by any means. This does have 72 weeks for the first part, and then an additional time, if you will, afterwards, where all the adolescents are receiving Pegvaliase. Yeah, and will continue to. Yeah, excellent. Thank you, Kristen, for that. Appreciate that.
Great. And we did get one more live question here from Kylie. Kylie asks, do you need to live within driving distance of one of the clinical sites to be eligible? We live in the Midwest, but we could fly to either Colorado or Indiana.
Kylie, thank you very much for that. And it's an excellent question. And now can we show the map of the United States? Sorry, Olivia. As I shared, and we have the ability for travel support, whether that be in an airplane, a train, or whatever mechanism. You do not have to live within a certain distance, if you will. We will support and pay for those travels, and that travel also includes, Kylie, a hotel if you need to spend the night for you and a parent or guardian. So there are opportunities absolutely within the Utah or the Colorado or other centers. I apologize, Kylie, I forgot. Bethany, where is Kylie from? Which?
In the Midwest.
In the Midwest. Okay. Okay, great. So there are a number of sites that you can actually call and contact to, and they would love to hear from you. So you do not have to be within driving distance. That is not a criteria. Yeah. Thank you for that.
Great. And yeah, it looks like Kylie said Kansas City specifically.
Kansas City. My geography is not so good, Kylie, so I will defer to you and the map.
And John has a follow-up question. After the study concludes, how long will BioMarin's support providing this to those in the study versus insurance need to take over costs?
That is an excellent follow-up question, John. And unfortunately, we are not part of that commercial team. So we are in the development part of the PKU. So I really unfortunately cannot ask that question. I'm going to ask you to write to the MedInfo folks or call them, and they may be able to address that for you. Yeah.
Yeah. If Olivia, if you can put up that MedInfo slide.
The MedInfo. Thank you.
With the 1-800 number, and then there's an email address, medinfo@biomed.com. Yep.
Excellent question, John. Yeah, thank you.
And I'm not seeing any additional questions come in. Does anybody have any final questions they want answered, something you've been thinking about through this presentation but haven't asked yet? We're happy to answer for you. So now's your time.
I think while they're all kind of noodling over some things, I might just throw it. If you are aware of an adolescent who's turning 12 in the next month or two or the next couple of months, who may be a potential candidate for this study where this may be an option, please feel free to reach out to your clinician or to an investigative center, because as I shared with you, and I believe it was John who asked that excellent question about the status of the study, we are recruiting, actively recruiting. So if you know of someone an adolescent who's turning 12 soon, absolutely please call either your clinician and or contact one of the sites that's listed here on the slide.
Great. It looks like John has a couple follow-ups. So how long is it for most people before they can start to eat differently off special diet?
So John, that's an excellent question. So we don't know right now. That's why we're actually conducting the study in adolescents, to be honest. So we don't know. We'll hopefully be able to, we will be able to share that data at the end of the study. But at this point in time, that's why we're actually conducting the study, but we don't know that right now. Excellent question though, John. Yeah.
And then one on top of that, John says his son is age 14 and wondering what is the average time length that side effects are experienced?
So we can't really share it. It's every adolescent behaves a little bit differently, and again, it's an investigative trial. It's an investigative product right now in adolescents. So we actually don't have that data right now. And that's why we're conducting the study, John. So it's really, stay tuned for that. And we'll be able to share that with you as we move forward at the end of the study. But thank you. Yeah.
Looks like Kristen has a follow-up. John says, thank you. Thanks so much, John, for your question.
Of course, John. Thank you.
Kristen says, my son is 17. If the study runs for 3 years, he will be 20. I believe this is already approved for ages 18 and up. Would he qualify?
Excellent question. And I'm really glad Kristen asked that, because it's the age, Kristen, at the time of their consented. So absolutely, 17-year-old adolescents are eligible for the study. They will continue to receive and be on study until the study is completed. Absolutely. Yes. Thank you.
Great.
Excellent question.
Yeah, thanks, Kristen.
It was very thoughtful. Yeah, appreciate that. Yeah, excellent questions.
Yeah, these are really good. Kristen says, thank you. Thank you, Kristen. Any final questions? These have all been really good ones. Not seeing anything else at the moment.
Okay, well, again, we're so privileged, and just it's a great pleasure, obviously, to work with NPKUA on this webinar and sharing this study with you. We encourage you to reach out to your clinician, to the websites that we've shared with you, and the phone numbers and the email, because this is enrolling, the study is enrolling, and we look forward to having further engagement with the PKU community. So thank you so much. We greatly appreciate it. Olivia, Kate, is there anything else that we need to?
Just thank you everyone for joining and for your good questions. And to say again, this was a lot of information. So you might walk away and later over the next few days, over the weekend, have some questions about the program. MedInfo, as you see here on the screen, email or phone are a great resource for you to submit those questions. So just really thank you. Thank you to Olivia and NPKUA for hosting us today.
Thank you, guys. Kate read my mind. I was going to ask what the best contact person or email would be if people have follow-up questions. So thank you. Thank you guys for taking the time out of your day to speak to all of us. And thank you to all the participants who have joined and for the interactive discussion. These questions are very helpful for everybody on the call. So appreciate it.
Thank you, everyone. Have a wonderful day. Thank you.